that would be really great. So nitrous oxide is becoming more and more used in the United States. It's been used in Europe and in Canada for quite some time. And so if you're a childbirth educator or a doula who is experiencing this within the clientele that you're serving, you may want to go ahead and explore it, so that when your clients come and ask you questions, you'll be better able to answer those questions. You know, you might even want to contact the local hospital if you're an independent. Contact your local hospital and see if they are in fact using nitrous oxide and what their practice guidelines are, so that you can speak authoritatively that way. That can also be very, very helpful. Just as an aside, wanted to let you know that this video is recorded, and it is going to be available on YouTube. I will post last week's YouTube address as well as this week's YouTube address. So if you have friends or colleagues that have not had an opportunity to join us today, they can always go back and look at that video at a later time. A couple more things before we have our guest on today. Tennessee has recently lifted a ban on the newborn eye ointment. Previously, it was a Class C misdemeanor for care providers if that was not done. That actually goes into effect July 1st of this year. So that was kind of interesting. I know that here in Ohio, they do have the option of using that. They can either use the erythromycin eye ointment, or I know that some hospitals even allow colostrum to be used in the eye right after birth. So that's kind of an interesting way of doing that. And finally, another thing that I wanted to talk about today is last week we mentioned about the California Vaginal Birth Toolkit, and it was not out yet. And then almost as soon as we got done with last week's show, it came out. So if you go to, and I'll give you the URL for that, although you probably have seen it, they've had almost 1,000 to 1,500 downloads so far. It's www.cmqcc.org/V as in Victor, Birth Toolkit. And you can download all of the information there. It's designed to increase vaginal birth, decrease cesarean, and also increase cultural awareness in terms of pregnancy, birth, and breastfeeding. And it's free. So that's a really great toolkit to have. The other thing you can do, I have a link on my website on birthsource.com. If you want to go to BirthSource and then in the search box, put in free, and you'll come up with a page that has all of the free stuff that's available to childbirth educators. There'll be links there, and it is definitely one of the links that I have. So yeah, take a look at the California Toolkit, and we have one person calling in, and that's our guest, which is cool. And I'm accepting her. And all of a sudden, I think she made the feedback go away. That's great. So I think the next thing for me to do while she's logging on is to actually introduce our guest for today. Our guest is Bertie Gunyon-Meyer, and she is past president of Postpartum Support International. She is the coordinator of Perinatal Moods Program at IU Health in Indianapolis. And for those of you who are not aware, World Maternal Health World Maternal Mental Health Day is tomorrow. And so that's why Bertie is here to talk with us and to share with us the information from Postpartum Support International. They have 2 conferences coming up, and one conference is in Fort Wayne next week. I believe it's on the 12th and the 13th. And she's having a little bit of trouble getting on air. Go ahead and try again, Bertie. This is a beta version of the program, so there she is. Maybe she can get in now. And then the next, their main conference for Postpartum Support International is in San Diego, June 22nd and 23rd. So if you're in that area, or if you would like to learn a lot more about postpartum mood and anxiety disorders, that conference would be a great one to attend. And we're waiting for her to... She's having some problems getting on. I know we had this problem last week with Jen. Jen had to completely shut down her computer before she could join. So I don't know, Bertie, if you can hear me, if that might be something that you'll want to do is shut down and start completely again, so we can get you on here. While we're waiting for Bertie to come on, I wanted to know, does anyone have any questions about anything that's been in the news this week? It's been kind of a slow week. I think that with school ending and Mother's Day coming up, things have been different as far as news in childbirth. We've seen a lot of things coming across the news feed about free childbirth classes. Of course, there's always the Kardashians and Adam Levine and his spouse and their pregnancy. But as far as true research, there hasn't been a whole lot other than the California toolkit coming out. Well, we're just not having luck today with getting Bertie online here. How about if somebody else tries to get on and see if they can click through, call in, see if we can get you online. Invite one of our other, we have about 12 people now. So if someone would be brave and click the call-in button and see if we can get you online, that might be helpful. All the joys of live TV or live internet shows. When things go wrong, it's never good. Some of the upcoming conferences, I know that A1 is coming up. I believe ILCA, the International Lactation Consultants, I think theirs is coming up in July. We have both, I know that in October there's Lamaze and ICEA and Kappa. They're all kind of clustered together. And that's kind of difficult because a lot of times educators and doulas really don't have an opportunity to go to every single one, especially when they're in the same month. That makes it really, really difficult. Okay, we're Still trying to get Birdie to log on. And we're just not having any luck with that. Wow, that feedback is really loud today. Well, if someone else wants to ask a question, again, you can go over to the right side of the screen where it says live chat, and down at the bottom it says send a message. You can send a message and we can talk about whatever you want to chat about. So far today we've been talking about attending conferences and nitrous oxide. We've talked a little bit about the new vaginal birth California toolkit, which has many segments to download. If you have not already downloaded some of the parts of the VBAC education project, that's the collaborative project between ICEA and ICANN and VBAC.com, which is the website owned and operated by Niset Jekalovics, who is a veteran childbirth educator and author of the Understanding the Dangers of Cesarean Childbirth. So yeah, just go ahead and send us a message and we'll see what we can do, what we can answer. Okay, here's one question that comes through. Says, how do you decide with all of the conferences, how do you decide which one to attend? Oh, wow, that's really difficult. One of the things that I look for first is speakers. And speakers are probably the most important piece of choosing a conference. The second piece would probably be how far away from me the conference is, how long it's going to take me to get there, and what mode of transportation I'm going to need to use. And then finally is cost. I do know that putting on a conference is very expensive. So it depends on the speakers for me, whether I've heard them or not. And if I have, are they speaking about something different? The other thing is if other people are going to be there that I know. That also plays into it, because a lot of times you can room with someone and cut down the cost of your conference by attending with someone else, maybe someone that you can meet there or that can go with you and share a room. And that can be nice. There are a lot of fun things to do at the conferences. A lot of times they have separate outings, and so you'll have someone there to pal around with. So that's really nice. Wow, we're just not able to get our guest on today. This is really not good. Birdie, can you try to call back? I know you keep trying. Hang up and try to call back. There we go. Maybe she can call in again and get back in. Here's another question. The California Toolkit, how exactly can we use that? The California Toolkit is for a variety of care providers, everything from childbirth educators to doulas to physicians, midwives, and nurses. So my advice is to read through the information and see what you can get from that information. See what kinds of things you can use in your own practice and adapt them accordingly. Oh, we're just not going to be able to work it today, I don't think. Oh, Birdie. This is very frustrating. Okay, here's another random question from someone who's watching the video. What is the best way to market yourself if you are an independent doula? I just got a message from Birdie. She says she cannot get in. One thing you might want to try, Birdie, is to shut your computer completely down and then bring it up again. That's one thing that helped Jan Camel last week, is to just completely shut her computer down and try again. So if you wouldn't mind doing that, that may help us. But as far as marketing yourself as an independent doula, there are a lot of different things that you can do. I know in our community we have had doulas take lunches, like maybe they'll get a healthy lunch for the office staff in a hospital practice and do a lunch presentation for that office group. They can explain what doulas do and what doulas do not do. They can explore the feelings that the practice has about doulas, especially if it's a negative impression. Maybe the physician has had problems with other doulas interfering or having difficulties understanding what is actually happening in the birth process. And so it's nice to have an explanation about what doulas actually do and what their limitations are, what certification is, and the process, regardless of what organization you're working with, that can be very different. And then the other thing is to always bring along either postcards or business cards that you can leave there with the physician or midwife. It might be a midwifery practice. And leave your cards there so that they can pass along your information should they have a patient that is interested in hiring a doula. They will at least have your information so that you can be reached. Another thing that I highly suggest is that you get a separate phone line from your regular cell phone, so that they can only deal with that phone number, so that you know when that phone rings, then it's a business call, and you can portray a more professional image on that call. One other thing that was really helpful for a lot of people is to attend health fairs and like community fairs as an exhibitor. A lot of times the community health fair exhibit costs are like $25 for a table, and you can have all of your brochures and your information on your table, and you can answer questions real time with expectant parents or grandparents, people who are looking to purchase the services of a doula perhaps as a gift, like an office gift. That would be a really, really neat thing to do, is to purchase a doula service for someone as a baby shower gift. That would be really great. And if you provide belly casting, if you do henna decorations on pregnant bellies, if you do blessing ways, you can have that information there too at your table. And that way you reach a wider variety of people for about the same amount of cost. So that would be my couple of suggestions, is to have brochures or business cards to reach out to the physicians, and then also try to attend some of the local health fairs in your community. Well, we'll see if Birdie can try to get on one more time. Again, this format that we're using, the Blab, is a beta tested version, so all the bugs are not worked out yet. which is kind of difficult for a host or someone actually doing this, because if all the bugs aren't worked out, it's kind of difficult. But hopefully she's closing down her computer and then rebooting it. Like I said, that helped Jen Camel last week, so hopefully that'll help her as well. We'll wait for some other questions to come on. If you have questions, just go over to the right side of your computer screen, and down at the bottom it says send a message. So just type that in and I'll be able to see that, and we can answer questions that you may have. Someone wants to know how to get more information about Postpartum Support International. That's a great idea. If you go to their website, which is, okay, I'm going to have to look that one up. I was going to say something and then I didn't want to, I will Google it here real quick. Their website is postpartum.net. And on that website, they have all of the information about the World Maternal Mental Health Day, which is tomorrow. I'm sure you've seen some memes around that will reflect that, but it's important that we get that information out to women so that they understand that this is not something that is only happening to them. It's happening to a lot of women, that there are services out there for them. I don't want to say that there are cures, but there are services and there are ways to work through the postpartum mood and anxiety disorders that they may be experiencing. So yeah, if you go to postpartum.net, that's the website for Postpartum Support International. Give it a few more minutes to see if our guest can log on. Sounds like, no, I thought there for a minute the feedback had stopped, but it has not. Well, let me text her and see if she can get on. Otherwise, we may have to postpone her for another day, which is sad because I really wanted to have her on today, being that tomorrow is okay, she is trying one more time. But since tomorrow is the World Maternal Mental Health Day, so I did want to have her on for that. I was just wondering, how much of the information about postpartum do you teach in your classes, or do you share with your expectant parents if you're a doula? I know that in my class, that was one topic that I was kind of afraid of for a while, because earlier in my career, because I wasn't really sure exactly what to present. And by that I mean, you know, there weren't a lot of books out about it, and there definitely was not the internet, so the information was very difficult to come by. But I think now with being able to access studies on the internet and all of the books that are coming out, a lot of the shrouding around postpartum the mood and anxiety disorders is coming down. And so we're able to learn a lot more. And so we as educators and doulas can provide more information for our clients in ways that they can understand. One of the most helpful things that I've discovered, there was a segment on the end of the video, Understanding Birth, that's available by Enjoy Video. And it was very, very helpful because there were real people discussing some of their issues. The mom was sobbing a lot. She was having trouble verbalizing what she wanted. The male partner was very confused. And so it really presented a realistic situation, so that was like a jumping off point, so you could work on that in your classes, or if you're showing it to your doula clients, that could be a starting place where you could actually begin to start that conversation. And knowing what happens during pregnancy, knowing what will happen during the postpartum period makes it a little bit easier, so that when it does actually happen, in those cases, the mom might be a little bit more prepared, know who her support system is, know how to reach out into the community, have that list of individuals that she can call, and know how to reach professionals to help her out. So I think we've really come a long way in the last few years as far as getting that information to practitioners like ourselves, and then also getting the information to our clients. So I think that's real important. So hopefully now we're waiting for her to reboot her computer. And I want to apologize for that because, again, this is a beta version, and so not all the kinks are worked out yet. So it's kind of like birth. Things don't always go the way you plan. So, you know, that's the way it is. Okay, we do have a comment. Someone who's watching says, I attended a training given by Birdie, and through other speakers learned how important it is to bring it up frequently throughout the class series, not just one session. You know, that's a really great and very important point. I know that in a lot of times we only cover like breastfeeding during the last class. We try to compartmentalize everything. And when we do that, we run the risk of our clients sometimes tuning us out. I'll give you an example, like cesarean. They don't think they're going to have a cesarean birth. It's not on their birth plan. So during that class period where you're talking about cesarean, they tune you out. And the same might be true of the postpartum issue. And so I really appreciate, her name is Nurse Collins 57. I really appreciate you bringing that up, because I think if we start the conversation early enough in the class, now say for instance you have a 4-week class, or even a 2-day weekend class, if you start the conversation about maybe about the hormonal orchestration of birth, and you start talking about how hormones will influence an expectant mother throughout the pregnancy and then afterwards, then perhaps you start customizing them to think, well, you know, I'm having some mood problems now, which may reflect on how things happen later. And, you know, we can work this out. And who are my support? And what community resources do I have? Okay, Birdie is giving it one more try. and I'm not sure it's going to be working today. Well, that went sideways a little bit. Well, it's not looking good for Birdie to log on to the Blab today. If we cannot get her on, I know she's very busy, and I don't want to take up too much more of her time. But what I'm going to do is reschedule her for a different day, so that we can have her on again. I just think that it's so important to get this information out. Yeah, we're just not able to get her logged on. Okay. Well, for some reason, the internet gods are not cooperating with us today. We're not able to get our co-host on. I want to thank everybody for tuning in today. I can't see all the attendees, but thank you so much. What I will do is I will contact her and have her on again. And she can still give us a lot of points and tips about postpartum and the emotions that moms often feel after the births of their babies. So thank you so much for tuning in this week. We are 10 minutes past our time. So I want to thank you so much for joining us. And next week, we're going to try, at least, to have Jennifer Shryock from North Carolina. She is the owner of Family Paws. And if you're not familiar with Family Paws, it's a company that will help expectant parents who already have pets incorporate pets and children together so that everyone can live in a good place. Sometimes it's very hard if parents have had pets for a long time. Those pets get used to just a certain number of people in the house, and when you bring a new baby home, sometimes that can be very upsetting. So Jen works with parents, and she has educators that are certified all over the world, so that'll be a really great conversation to have that next week. So. Well, that's it for this week. Again, thank you so much for joining us. And this will be recorded if you want to watch me blather on for a half an hour. This will be recorded and on YouTube as well. So thanks so much, and we'll see you next week.